Welcome. My name is Dr. Gualamuz, and I'll be presenting on Integrative Public Health. We're going to be talking about health policy fundamentals, reform opportunities, and challenges, all in the context of complex adaptive systems. Now, yes, it's a bit complicated, and we are going to be diving deep into specifics and details. And we're going to then also retrace and reflect from a broader or a more global and expanded perspective and scope. But we're going to be doing that strategically and be defining terms and concepts along the way so that it doesn't matter where you're coming in to the conversation from, you'll be able to catch up to. Now, the lecture or the video is intended as a resource to the audience for which I was invited to present to. However, I also wanted to make it public and share the insights to the broader audience and to the general public so that there can be an invitation and encouragement to engage in a more nuance-based conversation when we're talking about policy, when we're talking about mandates, public health, and everything that revolves around the U.S. healthcare system. So let's dive right into it. Hold on tight and have fun. So let's start off by breaking down a little bit of my credentials and background, and I'll touch on it briefly, but I do want to go through it because it does relate to public health, and so it starts off the conversation immediately. Now, as I said, my name is Dr. Gualamuz, and we're going to start right at the top here. So I'm board certified by the NCCAOM, which is a national commission, meaning it's a regulatory board at the national level, and it certifies individuals who have done two things primarily. They've gone through a rigorous 4-year, 3,000 hours master's level degree program and have passed 4 board examinations. One that's biomedical, anything you can think of that is that would be a biomedical or allopathic or Western medicine medical exam, which would consist of A&P, which is the anatomy, physiology, pathophysiology, pharmacology, all the biochem, microbiology, and so on and so forth, as well as an acupuncture board exam, which would touch on the acupuncture anatomy, channel networks, needle technique, clean needle safety, contraindications, so on and so forth, as well as the herbal medicine board, which would consist of the contraindications for herbal medicine, the synergies that happen with herbs or herb interaction as we customize and formulate herbal concoctions or extracts. Excuse me. And then we also have a foundations exam, which consists of all the theories or all the theoretics of the of each of the subjects. So acupuncture, herbal medicine, integrative therapies, and what they emerge from. So what I do want to elaborate on here is that there's a broad spectrum in terms of who practices acupuncture at the moment in the US. So it varies from state to state because of the regulatory boards. Some states don't have regulatory boards. Some states have regulatory boards that we can maybe even say overregulate. Now, in the state of Florida, I'm licensed in the state of Florida, by the way, as an acupuncture physician. We are, by statute, primary care providers, meaning that we are like your GP, your general practitioner, your family doctor, who you would go see for pretty much anything that's not an emergency, right? So we would be able to provide or order labs and imaging. We can provide treatment. The difference is here, we would not do, obviously, surgery. We wouldn't be the ones in charge of vaccination, nor prescribe pharmaceuticals or narcotics. Everything we would do would be through integrative therapies, where it'd be acupuncture, herbal medicine, manual therapy, physical therapy, diet therapy, all of that consists of potential therapies that are on the integrative scope that do not deal with specific pharmaceuticals that are regulated and are within the scope of MDs in specific or DOs. Now, the reason why this I wanted to touch on this was because the general public doesn't have very good awareness of what acupuncture is, even much less who to go to receive acupuncture and how to determine if the person is qualified or not. And believe it or not, even medical doctors or the healthcare professionals in the medical field have trouble with this as well. And at the very beginning, in the very first couple of years, I found this surprising. Fortunately, I've built many relationships over the years, and anyways, this is still an actual problem. There isn't a big awareness, and so many people don't know even if it's safe to send or to refer their patients to an acupuncture physician, because they don't know what kind of education they've gone or what kind of training is needed to provide acupuncture, which is it's a good concern to have, because within the spectrum of people that insert needles in you, there are big differences. Now, I mentioned to you that in specific to be NCCAOM board certified, you have to go through a 3,000 hour 4-year level master's degree program. This is the bare minimum to get licensed in the state of Florida as an acupuncture physician and to insert acupuncture needles and use it as a treatment. However, there are those other individuals in other states where there is no regulatory board, and just about anyone can put up a sign that says acupuncturist and start using acupuncture to treat people. So it varies from, we can say, maybe zero training to 300-hour training to the 3,000 hour bare minimum training that we have in the state of Florida. And other states, many other states have begun to adopt the same kind of standard of having a master's degree level through a 3,000 hour program and having passed the board examination, but not all states hold that same standard. Now, additionally, I've acquired a clinical specialty doctorate in TCM internal medicine. However, that's specific to me, and it's just because of my affinity toward expanding my knowledge base and acquiring specialty and advanced skills, but it is not necessary to perform safely acupuncture, nor does it do we need to require it for state boards to regulate licensure of acupuncture. This is simply just a specialty, much like a neurosurgeon would specialize in neurosurgery after they've gone through their medical training. Oh, by the way, I did want to mention that the implications of having this gap, right? So, for example, there are some programs out there that offer what they call acupuncture certifications, and there's really not much oversight on it, but they'll provide an acupuncture certification for someone having gone through maybe 300 hours worth of training on needling, and they provide this to the individual, and then the individual goes out there and starts practicing acupuncture. Now, what has occurred as a consequence of this huge gap and very variable kind of training, there's been very serious injuries and just events that have had severe consequences for patients. So there's been a couple very highlighted instances. For example, the one in the Olympics, there was an Olympian athlete who was unable to compete due to an injury from an undertrained acupuncture or someone trying to perform acupuncture. There's also been cases where they, even during a course where they were teaching, so I believe it was like a 300-hour training course, and the actual instructor who had received a 300-hour training course performed acupuncture and caused a pneumothorax. So there are some severe consequences of being undertrained and then performing acupuncture. However, I don't want to be an alarmist, because it's very safe if performed within how and what is supposed to be performed. There shouldn't be any cases where or very minimal, if at all, cases where there is a serious patient injury, because it is a very safe procedure, and it's just you are taught in, of course, a rigorous training. You're taught how to avoid harming the patient, causing injury, and avoiding these very dangerous and potentially fatal instances of puncturing organs and causing serious harm. So let's move forward with that and continue on our public health conversation. So you can pause here and take a look at where you're going to be exposed as the objectives for the lecture. I'm not going to go into this slide too much. I just did it in terms kind of like for reference and for index, and just so that you know what we would get into. Now, the strategy I do want to touch on a little bit, because it should bring you some peace of mind and just allow us to approach it calmly. So we're going to be breaking down fundamentals, meaning we're going to define all of these complicated terms. What's public health? What's complex adaptive systems? And what's integrative medicine, and how does it incorporate it? What's acupuncture, or how do we incorporate it? What's the research behind it? These kinds of things. We're going to go deep into how these specific things integrate or incorporate or interact with the current state of medicine, right? Then we're going to also take a step back and reflect on the current state of the healthcare system using research and some of the evidence that historical perspectives have provided us, and use some analysis strategies to compare our measuring tools, because we need to know what we're doing to assess the healthcare system, the quality of the systems, and is it appropriate, and is it impactful, is it meaningful. So we're going to be doing some very seriously complex discussion, but you'll be able to catch up because we're going to be doing it step by step in a strategy that's condensed, coherent, and cohesive, or provides some coherence. When we're done with doing all of our analysis, we're then going to move forward and start touching on some of the propositions. What are the opportunities and also challenges, but what are the things that we can do? What are the things that are before us that we can begin to integrate into our healthcare systems due to what's been made available to us? And what ideas are out there that can potentially act as reform guidance strategies. Now, the whole, as I said in the beginning, purpose of the lecture was to encourage and invite nuance-based inquiry and kind of engage a discussion, an interactive lecturing kind of presentation. However, in this format, the Q&A or the interactive part of it will likely happen in the comment section, or when you email me, or however it is that we're going to be interacting. Or maybe it won't be actually directly to us or anything like that, but it'll happen at your kitchen table, or it'll happen when you bring up the discussion, and you'll be able to use some of the insights that we provided here. However, the purpose of this video was and the lecture was to swiftly move through all of the information, so that then later on we can open up for a Q&A and a discussion and a debate, so that we can be attacking all of these different subjects at a specific level with an awareness of the broad consequences and impacts that our detailed policies are going to have. So with that, we're going to end part one. This is going to be the introduction of what we're going to do. And then we're going to start and dive right into it, into our next section, or on our next section. So thank you for watching. See you on the next video.